Hello and welcome back to another Future Doc House production. Let's continue our journey on Staphylococcus. Part 2, here we go. Staph does not cause diseases. Staph, the actual bacteria, does not cause diseases. That's why it can live on your body and be kind of harmless. Here's what causes the disease. Staph toxin causes diseases. Pyrogenic toxin. Whew, that's a mouthful. Basically, the toxin that causes fever or inflammation. Then this toxin causes these diseases: acute osteomyelitis, arthritis, and found usually in children. Skin infections, think acne. Tricuspid valve endocarditis, think IV drug users or IV patients in a hospital using an IV, an intravenous lead. Acute endocarditis, post-surgical wound infection, think surgery. Post-influenza pneumonia, think empyema. Empyema, what the hell is empyema? Empyema is pus and fluid-filled pleural cavity. Not an empanada, I know what you're thinking, you're hungry. Empyema. Postpartum mastitis. Now, if you are a female and just gave birth to a child and the child is, you're breastfeeding this child, this infant, this can happen. Postpartum mastitis. Basically, a bacteria gets into a milk production duct in your breast and you have inflammation of the breast because of your child, basically. Sepsis, bacteriemia, and abscesses. Alright. Again, that's the pyrogenic toxin. Now we have toxigenic toxin. Toxigenic toxin is basically a poisonous toxin. And this causes TSS. What is TSS? Toxic shock syndrome, caused by TSST-1. TSST-1, toxic shock syndrome toxin. And of course, tampons. TTT tampons. Tampons are usually the cause of this TSS, toxic shock syndrome. Gastroenteritis, caused by enterotoxin, basically a toxin that causes food poisoning. And of course, SSS, scalded skin syndrome. This is caused by exfoliatin. Alright, so there's your overview. Let's talk about virulence factors, shall we? Staph has virulence factors. What are virulence factors? Virulence factors make this bacteria pathogenic, basically, okay? And these are the, tools that the staph bacteria uses in order it to infect humans, okay? Here's the virulence factor number 1, coagulase. What is coagulase? Coagulase is only found in Staph aureus. Remember that. Only found in Staph aureus, coagulase. And it has fibrin protection against phagocytosis. It creates a fibrin protection against phagocytosis by macrophages. So it's basically putting up a wall of fibrin around the bacteria so that it can withstand a phagocytic, to protect itself against phagocytosis by a macrophage, usually. Protein A. Protein A binds to the Fc portion of IgG. The Fc portion is fragment crystallizable region of the IgG, immunoglobulin G, and this protects it against opsonization and phagocytosis. What's opsonization? Opsonization is the coating of a particle with protein marked for phagocytosis by macrophages. So if it protects itself from this protein coating, which marks it for death by a macrophage, then it prevents it from getting engulfed by a macrophage. So that's what protein A does. Hemolysins. Hemolysins destroys RBCs, red blood cells, neutrophils, macrophages, and platelets, basically all your immune system. That's what hemolysins does. It destroys all your cells, your, say, white blood cells and even red blood cells that would macrophages fight against the infection. Penicillinase. Penicillinase is basically the destruction of penicillin. It destroys the beta-lactam ring of penicillin, preventing penicillin from working and being effective against the bacteria. So a lot of bacteria that are penicillin resistant have penicillinase, which destroys this drug, penicillin. Leukocidins. Leukocidins destroys leukocytes. And there's a CA MRSA, which is community-acquired methicillin-resistant Staph aureus, which produces Pantin-Valentine leukocidin. And this forms abscesses. So with a lot of patients with community-acquired MRSA, they have abscesses. Here we go. Abscesses, okay? Hyaluronidase. It breaks down peptidoglycan, allowing the spread of the bacteria and to be invasive. It breaks down the human's peptidoglycan. Staphylococcus breaks down the fibrin clot. So if there's, again, a fibrin clot preventing the spread of the bacteria, this breaks that down so that the bacteria can spread into the human body. Lipase, again, degrades fats and oils. Think acne, so it degrades the fats and oils that are kind of allowing the bacteria to invade and cause usually acne. Protease destroys proteins, again, for invasion purposes. Now we have staph toxins. So we talked about staph toxins here, but now we're going to go into more detail here. Exfoliatin. Exfoliatin causes SSS. It causes the skin to slough or fall off. The exfoliatin is called exfoliative toxin A and B, and it's similar to toxic epidermal necrosis or Stevens-Johnson syndrome. Look up Stevens-Johnson's syndrome. It's quite interesting, and a lot of drugs can induce this syndrome. So don't get Stevens-Johnson syndrome with the SSS, scalded skin syndrome, caused by exfoliatin, okay? They were going to try to trick you, so that's why I mentioned it. Enterotoxin, this is a heat-stable. Heat-stable toxin cannot be destroyed by heat. It causes food poisoning, vomiting, and diarrhea less than 24 hours. So if you have vomiting and diarrhea after eating something, usually mayonnaise, within 24 hours, think Staphylococcus bacteria and the enterotoxin that it's producing. Toxic shock syndrome toxin. It's analogous to the pyrogenic toxin of S. pyogenes or group A streptococcus. Now this is very, very tricky. Okay, the symptoms are very much the same. Okay, you have a patient with toxic shock syndrome, and the symptoms are the same, whether it's caused by Staph aureus, say a Staphylococcus, through tampons, or by a Streptococcus pyogenes, or also known as the Group A Streptococcus. This is very, very similar. Here's the difference. First, staph and strep can be grouped in different ways because staph comes in clusters, and strep under the microscopic view are in chains. Clusters, Streptococcus, chain. And another thing is that the disease is usually different. So they'll usually mention a tampon or some other clue for you to choose. It's the toxic shock syndrome toxin and not the pyrogenic toxin of S. pyogenes genus. Now basically how this toxin works is it's a super antigen. It binds to MHC2. What the hell is MHC2? MHC2 is major histocompatibility complex class 2. A mouthful. Basically it attaches this, which is on APCs or antigen presenting cells such as macrophages, and it induces basically a massive T cell response and an outpouring of cytokines. What cytokines? Proteins for communicating and cell signaling, specifically TNF alpha and IL-1. TNF alpha are tumor necrosis factor causing inflammation, and interleukin 1 causes inflammation. So this basically creates this toxic shock syndrome of stimulating your immune system to the point where it's just going crazy. And that's where you get the toxic shock syndrome. Toxin. Okay. There you have it. Part 2. If you like this video and you want more of these videos, please click subscribe. Thank you and have a nice day.
She is a good student, but instead of just reading textbooks late into the night, Jennifer uses technology to help her study. She also watches lectures on YouTube and practices her knowledge with QUPI, a medical quiz app and online platform. Jennifer likes QUPI because it has 10,000 practice questions covering her entire medical course. This means she can practice her medical knowledge from anywhere and in a way that actually prepares her for the exams. Begin your 7-day free trial with QUPI today.